Hi there. My name is Andrew Lane. I am currently a clinical research nurse manager at the Arizona Emergency Medicine Research Center at the College of Emergency Medicine at the University of Arizona. It's a long title, but basically what I do is I oversee a team of clinical research nurses who function in the emergency department 24 hours a day on a couple of different campuses to screen, consent, enroll, and perform the protocols for medical research in focusing on emergency medicine and critical care. Currently, we have 6 active studies. We have 4 stroke trials, we have 1 septic shock trial, and we have a traumatic brain injury trial, all involving experimental drugs or new uses for approved drugs, and even one experimental device trial. And we also have approximately half a dozen trials that we are working on getting implemented at our sites. My job is performing primary study coordinator duties for those trials. It involves regulatory communication with the investigational review board at our site. It involves personnel issues with our teams of nurses who, as I said, cover 24 hours a day on 2 different campuses. Um, and I also interact with the primary investigators on all the trials and in different departments that we collaborate with. We are a multi-spoke hub, which means that our offices are in Tucson, but we do research in Phoenix, New Mexico, Oklahoma, as well as a couple of different sites across Tucson. Uh, we also function as float nurses in the emergency departments. When we're not actively involved in research, we actually help out the hospital staff, even though we're employees of the university. Our average nursing experience is about 7 years between ICU and ED. So we try to provide a valuable resource for the nursing staff in education, in hands-on patient care, in process improvement issues. So it really is beneficial for the hospital as well as for the university. Um, I found that sharing information for networking purposes is really helpful. Even if you and I don't have anything in particular to help each other out with, we can hang on to that information and hopefully connect with somebody else down the line. So uh, I may be able to say, "Oh, I know a guy in Dallas that can help you out," or "I know a gal in Phoenix that can help you out," and I'll pass on your information. So I'd appreciate it if you hang on to my information, even if it's not useful for you today. Maybe you can hand it off to somebody else down the line. Thanks for your time and enjoy the rest of your day.